Hello. This module will be discussing health policy and advocacy. There are three learning objectives for today's class. We're going to discuss the functions of health policy as it pertains influencing determinants of health. Going to discuss the use of policy making to address population health challenges, and then finally describe the role of advocacy and lobbying in bringing about change in the determinants of health. So, health policy, in a nutshell, are authoritative decisions, and they are often made at the government levels. This could be federal, state, or local government, and it could be government institutions or government agencies or elected officials to some extent. And then the purpose of health policies is to direct or influence the actions and behaviors of the population, and it is specifically focused on health and the determinants of health. So health policies can come in different forms. For the most part, we generally kind of are very more used to the law aspect of it, the health laws that are made at different levels of government, made at the executive or legislative, or sometimes with the judiciary. But health policies also include rules and regulations that are sometimes do not go through the whole policy formulation cycle. For example, you could have different agencies make decisions based off on, let's just for example, what at what age it is okay to buy alcohol and stuff like. I know in some countries, I'm not too sure whether it happens in the US, you cannot buy cigarette unless you are 18 years and older. But then, and also some of the rules and regulations that are kind of health policy will be the taxation that is placed on cigarettes, and also just to kind of curb its use. So those are the kind of rules and regulations that are part of health policies. But you can also have operational decisions that are made, and operational decisions generally take the shape of when you have laws that have been made, and the laws are generally high level and they are rather broad. And so but you have to implement them. You have to implement these laws. You have to implement the rules and regulations. To do that, you have to kind of drill it down to make it easy for operationalization, and that is where operational decisions come in. And this is generally done by the agencies that are going to implement the laws or implement the rules and the regulations. But judicial decisions that are made, let's use for example when some states took ACA to court about what's it called? Opting in and out of Medicaid expansion. That's and a decision was made on that, saying that they could opt out. That is a judicial decision, and that is all part of the health policy. So, in case you guys have not yet seen this, this is the socio-ecological model of health and well-being and wellness. You can click on this link to take you to an article that kind of explains what that is. The socio-ecological model is it covers a lot of ground, but one of I want to talk about it as it pertains sphere of influence. What the socio-ecological model tries to teach is that there are different levels at which change can happen or change can be made. You can have the intrapersonal, in which case maybe you change your attitude towards something. Let's say you used to drink a lot, and then one day you decide, I don't want to drink as much as I used to do. Your attitude towards drinking has changed, and therefore there's a change in your behavior. It could also mean you maybe gained some new knowledge, and then your behavior changes as a result. So that is a change that happens during in an intrapersonal level. But changes also happen from a policy level. In this case, they are national laws and policies, they are more, more easily, well, not more easily, they are enforceable in the way that your personal convictions are not enforceable. And for the most part, they have a much broader sphere of influence and have a much greater degree of impact because they can affect a lot of people, and also they are not having to kind of depend on people having their individual convictions or their individual knowledge is changing. It just basically says you have to do this and therefore you have to do this. So it has a much greater sphere of influence and degree of impact. So that is why health policy kind of comes in to do that. There's a change that needs to be done, and we want it to, be done by a greater number of people, and therefore we have the policies instituted. But getting policies passed, getting policies out is a laborious, time consuming, and expensive process and project. So you don't immediately go to policy for every healthcare problem that needs a solution because it takes time, it's very expensive, and it can, it while it has a very high degree of impact, it is not always the best solution for every health problem. So this is an illustration of how a law is made, a health law is made. This is from the executive level of it, from the federal level. A part of it also happens within the states with the governors, and it starts from the bill being introduced in the Senate and then it's being passed into law. So this is not a straightforward process. It's not a linear process. It can take a lot of back and forth and back and forth and drag on for many years. Which, like I said, policy solution takes time and not always the most practicable of solution for every health problem. So, policies can be driven by states. An example would be what the states did with the expansion of ACA, and it could also be done through interest groups. In an interest group would be, let's use for example, the American Heart Association or the American Hospital Association. These interest groups, for the most part, they have quite a lot of power in sense of getting the changes that they want done, and what happens is that they have a basic interest in trying to get something done, something that is of, let's just, for example, they're trying to regulate something. Okay, I'm trying to use the American Heart Association for an example. Let's say they're trying to push for healthier way of eating or healthier meals and stuff like that. They can push for trying to change nutritional packaging, the way things are, how the nutritional labels are done. Try to let people understand, okay, this is the content of food and stuff like that, and all of those things. So they can push for it because as they are. From the association. If you're going to do anything that involves, heart or heart related illnesses, they are a partners to have because they have a lot of pull and they can help, they have ears that they can talk, people that have their ears and they have to talk to them and stuff like that. So there are a lot of policies that get driven from the interest group that can push for things to be done. And I think what happened also with ACA was there was a lot of interest groups that were really interested in talking to many people, in pushing for lobbying for different aspects of of the law to include different components of it. So they are really powerful people entity when it comes to policy making, interest groups in this case. So why health policy? So the idea of health policy is that they address determinants of health, and by addressing determinants of health, they then bring about the desired health outcome. An example would be, say, the problem of low insurance coverage among Americans that happened before pre ACA, and then ACA came in as a solution to that, and the policy was for Medicaid to be expanded. So, what the determinants of health that policy targeted was health services in the sense that it's removed pre-existing conditions, but it also made it such that mental and behavioral health services don't have a different type of insurance policies as physical health. But it also, really pushed for getting lifting cap on coverages, especially for mental health or behavioral health services. So they targeted and the number of determinants of health, and what then happened after that was increased healthcare coverage, and this was mostly seen among low income population. So that is how health policies are interconnected with determinants of health and health outcomes. So this diagram, which unfortunately isn't very clear, but you can pause at this point and just zoom it in so that you can get a better sense of it. So what this diagram does is to show you in a more complicated or intrinsic pattern how health policy works with social determinants of health, in how it happens in a, let's say, in a community setting involving a number of players and then involving a number of factors. So you can take a pause, really look through it. It's very, very educational. Just have a quick one so that you get the you understand what that is talking about. So, drivers of change. Now, let us say you are a program manager in an organization, and in your organization, you want to get make changes done in the way of healthcare payments reform, non-traditional competitors, workforce, and new digital solutions. What you could do is, let's say, for the financial issue, institute an alternative payment model, and in technology, you could expand continue via telehealth. Now, this is a decision that will take a lot of back and forth and talking with all the different key stakeholders and partners that are going to be involved in this, both the suppliers and the people who are going to use the service at the end of the day. However, it is a much simpler and easier solution to bring to kind of institute and implement than, let's just say, for an example, you are a member of the state's Medicaid Advisory Board, and the Medicaid director has been given charge by the governor to slow the state's rising Medicaid cost. And the options that you have is as follows. Now, this is going to be a much harder solution to implement than this. I'm going to give you an example why it's a much harder solution to implement. Let's say you want to convince legislation to cut eligibility levels. Now, that is going to give you a lot of pushback. You're going to get a pushback from the legislators from the other political party. You're going to get a pushback from a lot of lawyers who may be arguing for, oh, we already have a problem with enrollment, with Medicaid coverage. If you cut eligibility, you're going to have a lot of people who are going to be with health insurance. So you're going to get a lot of pushback. If you decide to impose administrative burdens, oh, that is going to be a PR disaster. You're going to be all over the news. The same thing if decide to cut benefit, cut reimbursement. Huge PR disaster. You're going to have people coming up and telling you, saying on the news how much money they already spending on healthcare, how they've been made bankrupt by one step. So it's just not something you want to touch. But you could say, okay, fine, let us cut pharmaceutical costs because they have a lot of money and they can afford to take a little bit of hit. Well, they have a very strong association that can push, and if push comes to shove, they could possibly go to court and stuff like that. So that is not an easy solution to go either. You could say you want to reduce fraud and abuse, but you are going to have to make a case that there is indeed fraud and abuse, and that whatever solution you're coming up with will indeed, solve those problems. So, as you can imagine, this is a simpler solution to get enforced than this. So that is how health policies work. They're very complicated to use in terms of getting them implemented, getting them enforced, because there are a lot of stakeholders, a lot of interest groups, a lot of competing interests. They are going to push back when you make these decisions. And this is where you need to consider policy making and the science of policy making, if you will. So one of the things to consider with that is the political side of it. Do you have bipartisan support? If you're going to cut pharmaceutical costs, you're going to have the support of the pharmaceutical association, because without them, they're going to oppose very strongly. So that's why you need to know who your supporters are, who your opponents are, and who will benefit and who would be, adversely impacted. You also need data. You need evidence to back up the policies that you're trying to make. An example would be, say you say, okay, we want to address fraud and abuse. Where is the data that is actually saying that there is fraud and abuse? And not just that, does the data actually say that the fraud and abuse you say that there is having the impact you say that it is? So you can't just come out and say, oh, we need to do this. You have to have data to support the decision that you are making. Something else to consider is when it comes to budget. I'm going to use an example of the fraud and abuse this case. So trying to tackle fraud and abuse is going to take money, it's going to take time, because it may require a system overhaul. System overhauls cost money. Now you're going to have to make a case that the amount of money you're going to spend in overhauling the system as a way of addressing fraud and abuse is actually going to be a good trade-off for the what it is that you're trying to solve, which is reducing Medicaid's bill. Because if you're going to spend, let's just for example, $2 million in overhauling the system, and all you save is 1.8 million, that is not a good sell. So there has to be budgetary considerations that has to be made. You also want to think about implementation. What will getting this policy mean? Because sometimes some policies look simple, but if you effect them, if you put them in effect, there may be a whole lot of problem they will create that you now have to solve. So that is something to consider. And also, is the policy going to be supported by people when it's executed? Or is it that when you execute it, they are going to really oppose it and or refuse to engage in it? They refuse to use the services, for example. That then becomes a big problem for you. So some of the things to consider when you are doing policy making. So finally, with advocacy, it is really, really important. At least at this point, I have alluded to it. You cannot have policy without advocacy. There being that there are a lot of opposing parties, a lot of opposing interests that is going to push back on your policies, because there will always be supporters and there will always be opponents. So you need your advocacy to get your supporters, get their voice to be loud, and either convert your opponents to supporters, or have your supporters that are so loud that it drowns out the voice of your opponent. But either ways, you need advocacy to get that done. So in advocacy, we are kind of looking at, an action that is done to support a cause. You're speaking for a cause. A lot of the time, advocacy happens for vulnerable groups. There's also no limit to, how much non-lobbying advocacy that can be done. Advocacy is not the same as lobbying. With lobbying, we're kind of, the idea is attempting to influence policy making, and it is at the legislative or executive branches of government. And advocacy can be more grassroots. Not to say that lobbying doesn't can be grassroots; it can be grassroots, but for the most part, lo- advocacy is there's a little less is I want to say is a bit more passive than lobbying is. So advocacy generally happens for people who unfortunately do not have a lot of power. I don't know how to explain it in a way that is going to be easy. So there are people whose voices are heard, right? They can get things done by, they have a lot of influence, they have a lot of power to make things happen. They can lobby for things. I'm going to use an example of what Kim Kardashian did with the prisoners that got set free. That was more of a lobbying, going to meet President Trump and do that. At this point, we're talking lobbying. Now, when she goes on social media and, does a lot of advocacy and trying to get people interested in the case, interested in this individuals, that looks more on the advocacy arm of it. So if you're lobbying, for people who are lobbying, you have to be registered and disclose, information such as who is funding you and what costs are you being funded for. Because you want to avoid a situation where there's a lot of fraud that is happening with lobbying. Because remember, they have a lot of power in the way that advocacy doesn't. So you don't want them to have an undue power over things. So, long story short, as a population health manager, when you want to have change made, you are going to have to understand the people for which you are making change for, understand the activity that you're trying to bring about change for. And this means that you need to connect with the people in the community. You need to understand their experiences, what their needs are, what their challenges are. Community needs assessment can help you with that, but you also want to utilize the knowledge of the community, of the assessment, of engaging with the people to develop creative and desirable solutions. To do that, this is where your change management strategies that we discussed in the last module does come in. Remember, they motivate the elephants, create agency and stuff. So that really comes into that. It's really important. This change management doesn't just happen within organizations. You use that also for your community advocacy and for lobbying exercises. So that is where we end for today's class. Do use the Q&A board if you have any questions. Bye.